name's Tiffany Wall. I'm going to be your student nurse today. Could I get your name and date of birth? Okay, very good. And can you tell me, do you have any allergies to medications, latex, tape, betadine, anything like that? No? Okay. Well, I did close the door and provided for privacy here. I'm going to wash my hands. So I verified the doctor's orders that she put in for a sterile dressing change. So that's what we're going to do here. So I'm explaining to the patient what we're going to do. And the wheels on the bed are locked. The bed is currently in the low position and the side rails are up. So the patient is safe. I am going to be raising the bed, however, to just the waist level or just above so that I maintain sterile technique when I'm doing the dressing change. And as you can see, my supplies are raised as well. So what I'll do now is I'd like to know, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain imaginable, do you have any pain? And if so, where on that scale would you rate it? No? No pain? Okay. Very good. So you don't need any medication. All right. So what I'll do now is I'm going to put on my gloves. I did my hand hygiene. So I put on my gloves. And I am going to remove this old dressing. So I'm just going to kind of pull up here. Let me know if I'm hurting you at all. And I'll be kind of putting the tape underneath the dressing so that it doesn't keep sticking to the patient. Doing okay? All right. Very good. One more side here. And once I get this off, get that under there, I'm going to assess for COCA, which is color, odor, consistency, and amount. There is, you may be able to see, there is it's kind of a light pinkish color here, so I would call this serosanguinous discharge on my 4x4s. There, it covers, I'd say, it's kind of in the center, so maybe 1/4 to 1/3 of the pad on each one. Again, there's no odor. Consistency, there don't appear to be any blood clots, and again, the amount is probably about 1/4 of this 4x4 on each one. So now I can get rid of this. Actually, I'll put it in this hand. And I will get rid of my gloves here. I have my trash can here. So I'll get rid of my gloves there. And now I am going to perform hand hygiene again. And I'm going to assess the incision for RETA, which is redness, edema, ecchymosis, drainage, and approximation, which is how the incision comes together. So I am seeing a little bit of redness right at the edges of the incision along. It's a little bit purplish and blue, so there's a little bit of ecchymosis around the edges. I'm not noting any edema. Drainage, a little bit of dried right along the center of the incision there, so we'll clean that. And approximation, it is well approximated, meaning it's coming together nicely. So now I will, or it's intact, I should say. Now I'm going to measure, and I'll be sure not to touch the patient with my measuring device here. And it is approximately 5 inches. So I'll be sure to note that, and I will count the number of staples, and I have 1, 2, 3, 4, 5, 13 staples, and that is how many there should be there. So this incision is intact. So now I'll do hand hygiene again, and I'm going to go ahead and start the sterile portion of the procedure, making sure I keep everything between shoulder and waist height. Of course, the bed is lower than it should be. But say it is what it is for this. So I'm going to start off by tearing some tape, and I'm going to utilize this for my alcohol swabs. Okay, so I have that. I'm going to put that there, and I'm hoping it doesn't stick too much to my table here. So now with the alcohol swab, I have the betadine. It would be betadine, but for here we have alcohol. I pull it that way into the center there, and then it pulls off. Not as easily as I would like it to, but I'm going to kind of push the swabs up, ensuring that I don't cross over the sterile field here. So I'm going to push those up, and then I'm going to fold it underneath. I'm going to take the tape that I pulled here and put it across here and place it here, hoping that it stays there for me and that it doesn't fall off. Okay. So first I'm going to start by preparing my 4x4s. I'm just going to kind of pull the top open here, and I'm going to lay it down, stabilize it, and pull this back. And I'm going to slide it over here. Then I'm going to do the same with my abdominal pad. I'm going to open that a little bit here. I'm going to lay it down, stabilize it. Oh, I'm going to go this way with it. Stabilize it so I'm not crossing over and pulling back. And of course I'm keeping everything above my waist here, touching only edges. Now it's time for the gloves. I'm praying this goes well. So I take my gloves out, toss that, put my gloves here, open. I'm going to open, and my gloves would not be touching my pads here, although my workspace is a little smaller than I would like it to be. So I open away from me first, then towards me. Then using these flaps here, I just put my fingers inside here, only touching the edge. And I see my glove is sticking to the inside there, so I got that down. Then I pull that open. And again, normally my gloves would not be touching any of my sterile materials here, but again, my workspace is smaller than I need it to be. So to put on, I'm right-handed, so I'm going to put on my right-hand glove first. I'm going to come and kind of turn, and I'm going to, using the cuff only with my non-dominant hand, I'm going to insert my right hand, only holding on to the cuff, trying to find my thumb here, and pulling up. Then for my left hand, I come under the cuff here, and I'm going to get rid of that. I'm making sure to keep my thumb away from my sterile glove, and I take my left hand and making sure I keep everything above my waist, and now I have, and below my shoulders. Now I have my sterile gloves on. So the first thing I'm going to do is I'm going to take my betadine swab, only touching the handle of it, nothing else. And I come over to my incision, ensuring that I keep my sterile gloves off the patient's skin, as the skin is not sterile. And I roll down the center of the incision, ensuring that I'm getting in between all of the staples, ensuring I'm not touching the skin, and rolling all the way down. Then I come away and keeping sure that my hands are above my waist, below my shoulders, I drop my swab. I could be in the NBA. That went very well. Now I'm going to take my second betadine swab, and I'm going to do the incision the area furthest away from me. Again, ensuring that I don't touch the skin. I can roll, or I can just kind of sweep my swab down along that edge of the incision. And again, dropping into the waste can and grabbing the top of the swab. And again, not touching the skin, just rolling on the inside of the incision closest to me, rolling, or you can kind of sweep it down as well to the end there. Okay, then again, I drop this one into the trash can. Now I'm going to take my 4x4s, and there are 2 of them. So I'll pull them apart, and I will, from the side away from me, I'll just kind of drop it down, and wherever it falls, it falls. I'm not going to readjust it because I don't want it to become unsterile. And I'll do the same with the second one. Now I will get my abdominal pad, and the blue line is up. So I'll come, I'll make sure that I place that on there like so. You okay? Doing okay? All right, and now the sterile portion is over. And since my gloves are still clean, they're not soiled, sterile, I'm going to begin taping the incision. Not the incision. I'm not going to tape the incision. I'm taping the dressing. And I'm going to measure the side here. I'll do the side away from me, making sure I keep the sterile parts over, but making sure I'm not contaminating anything here. Okay. And the bottom. And one more here at the top. Still doing okay? All right. Okay, now I'm going to take some tape and I'm going to write my initials, the date, and the time. And I'm going to place that here on the dressing so that the next nurse knows who did this, when it was done, and the date. So now I will take off my glove, well, clean everything up, take off my gloves. That. Do hand hygiene. And I would make sure I would put the patient's bed back down to the lowest level, put the rails back up, and clean up all my materials. And that is my sterile dressing change. Thank you.